Noon, Thursday, June 4th, 2026. We're streaming live spine surgery from Deuk Spine Institute, the home of the Deuk laser disc repair, the most advanced laser spine surgery procedure in the world. Deuk laser disc repair has been performed on 2,772 patients. I guess this is our 72?
I believe so, yes.
Yeah. So over 2,770 patients. In 20 years, we've never had a surgical complication. That's a complication from the surgery. And patients go home an hour after surgery. For those of you wondering how the last patient did, she is on her way out in about 30 minutes. She's awake. She's getting changed, going to the bathroom. She had the cervical fusion. Shot? All right, we're going to get started. And if you have questions, feel free to ask. In the meantime, please look at Anthony's video. He's going to show you, shot AP, while I place the needles. He's going to show you the 30 different causes of back pain. Back pain is the most common medical complaint in the world. 1 billion people worldwide suffer with chronic debilitating back pain. And this surgery you're watching right now is the #1 treatment in the world, the most effective, the safest, and the most permanent. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Welcome back. You can see from the video that there are 30 very specific causes of back pain. 30. We know all of them here at Deuk Spine Institute. We can treat almost all of them. As a matter of fact, Deuk Spine Institute can cure 99% of lower back pain causes. Lower back pain. This patient's had back pain for 15 years. He comes from Seattle. He's traveled across the country. Our last patient earlier today, she came from Hawaii. So he's from Seattle, she's from Hawaii. He's had surgery before with us on his neck, right? We did a cervical. He was so happy he wants his back fixed. So we're going to try to fix his back today by repairing 3 discs that are damaged. He's got 5 damaged discs in his back, but only 3 of them are causing back pain, in my opinion. Are you awake?
How are you doing, sir?
Lay still.
Don't move. Okay, don't move.
Are you having any back pain?
No, don't shake your head, sir.
Just say no or yes. All right, I'm going to ask you if you have pain on a scale of 1 to 10, how bad it is. Folks, look at this incision right here. This is a 1/4 inch. The whole surgery is being done through this tiny little cut. We're going to fix 3 discs. Had he gone anywhere else in the world, he would have an incision like this. Are you having any back pain? How bad is that on a scale of 1 to 10? What's the highest?
7.
I heard 10.
7, 8.
All right. The highest, it was an 8? Was the highest an 8?
Yes.
All right. Is that where you get back pain? Good news. That's going to be gone when you wake up. That's 8 out of 10 concordant. Is it better now? Is it gone? Yes?
No, don't shake your head, sir.
You can't shake. We can't see you. You got to say yes or no. All right. So we tested the L5-S1. It's definitely causing his back pain. How bad is that on a scale of 1 to 10? What's the highest?
8.5.
9. We don't do 8.5. 9 out of 10. Is that where you get back pain? Congratulations. That's 2 discs we tested. Both of them are causing pain. We're going to fix that for you. How bad is that on a scale of 1 to 10?
9.
9. Is that where you get your back pain? Congratulations. We've tested all 3 discs today that we're fixing. And that pain will be gone when you wake up. I want you to count out loud from 1 to 100. All right, so folks, Just count out loud, 1 to 100. What's happened here is when I did my MRI review with this patient, which is a virtual consultation over Zoom, I had him show me where his back pain was on his back. I had him press on some areas. We did a quick exam. It took about 2 minutes. And at the same time I was looking at his MRI, I was able to associate what's wrong on the MRI with where his back pain is and come up with a diagnosis. We call that the Deuk spine exam. It is a special examination that incorporates physical exam, MRI, history, and experience. And we were able to diagnose accurately the cause of his back pain. So now we know 3 discs are causing it. We're going to fix these 3 discs right now. Any questions? Feel free to type up the question, and I will do my best to answer it for you. Our patient that we did earlier from Hawaii, she's getting ready to go back home, actually to the hotel. She'll come in tomorrow to get her drain taken out. Num num. All right, can you see the x-ray there, Anthony?
Yes, we can.
You can see that there's the dilator where Jordan is using the white arrow to point to it. You can see the dye in the epidural space up above, tracking in front of the dura up above. Yep, up there. So it came out of a tear at L3-4 and shot up. Shot? All right, right now I'm about to bring the dilator down into the L5-S1 disc. May I proceed? This is where all of his pain is coming from at L5-S1. Wait. Shot. Go. So I'm going to go inside the tear, clean the tear with a laser. This is all done with endoscopic visualization through a 1/4 inch incision. This is a technique that I pioneered at Deuk Spine 20 years ago. And we have peer-reviewed and published this surgery 11 times. You can find those publications on our website. Those publications are all peer-reviewed, published, and presented at national meetings for neurosurgeons. I've been bringing this technology to the forefront of neurosurgery for 20 years. And yet we're still the only ones doing it because everyone else is motivated to do fusions. Fusions pay better. All right, look at this. This is the blood from the surgery. I've got great news. This is a true American. Just in the time of our 250th anniversary, he's got red, white, and blue. Any questions?
Yes, we have a question from Spicy Irwin on YouTube.
Spicy Irwin, welcome back.
Spinal stenosis has got not just my leg, but my foot with electrocuting pain. I got epidural 2 weeks ago. It's time. Thank you for your procedures.
Oh, you're welcome. Was there a question in there, or are they just stating those things?
It was a comment. My
Oh.
bad.
Thanks for commenting. Yeah, we don't typically recommend epidural because epidural is a temporary treatment.
Good? Let's beat it one more time. Let's go.
Maybe it wasn't so tight. What do you think, Jordan? Did you feel it move? Last 1/4 millimeter? Yeah, any space between the laser fiber, what is that called?
The blast shield?
The blast shield and the what is it, the adapter? Yeah. Well, all right. So this is the laser. It's basically, let me have the grabber. It's basically being used to remove the herniation. I'm going to use my grabber. Let's get something done, guys. Let's choose. I felt like it just wasn't burning as well. So if you have questions, feel free to ask us. These blue,
And another
pieces you're seeing are pieces of herniation. You guys see that?
Yes, we do.
So there's a piece of herniation right there coming up. I've got this if you want to go supervise. All right. Any questions?
No questions.
All right. Earlier, we showed you a video at the beginning of the surgery where you guys could see the 30 different causes of chronic back pain. And of those 30 causes, one in particular accounts for the most back pain of all, and that is the disc injuries. That's what this patient has. This patient has a disc injury. As a matter of fact, he's got 5 discs that are injured, but only 3 of them are causing pain, and the other 2 are not. How do I figure that out? My experience, and combine it with the physical exam, the MRI, and my experience in treating back pain successfully over many years, curing people's back pain. I rarely ever see L1-2 or L2-3 causing back pain. It's very rare. So the most common discs that get injured and cause back pain are L3-4, L4-5, and L5-S1, which is what this patient has. Now, you can see the inflammatory tissue. You guys see that right there? It's kind of pink in color. That pink color is inflammation. It's very mild. Leave the other fiber there just in case. It's the machine. Have another machine ready. Jordan, you want to check the tightening and make sure it's on right before we get started? All right, let me know when we can start. By the way, you see the blue fiber here, okay? The blue fiber is called, we call it the laser fiber, but it's an optical fiber. It transmits energy along that little glass fiber. It's actually made out of glass, very pure glass. And the laser energy bounces from one side to the other as it moves forward in the fiber from the laser machine all the way to the end here, where it's emitted out onto this abnormal tissue that I'm removing. The blue itself is just plastic. It's a plastic coating to protect the glass and keep us from breaking the glass. Okay, we're going to get restarted. Hey, come on over here, Hector. This suction line is right where my foot is going in to the laser box. Okay? Yeah. That's what we need to do. Thanks. Okay, any questions? If not, that's much better. What I'd like to do is show our audience how a disc injury, the number one cause of back pain, how it actually causes back pain through inflammation.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see from our video that the disc injuries cause tremendous pain through a process called inflammation. Same process that we deal with when we're young, when we have pimples on our face that are painful and tender and red. Those pimples are areas of inflammation in your skin caused by infection. That infection is bacteria growing in a hair follicle or a sweat gland. that bacteria, as it grows, your body starts to recognize that it's there and it shouldn't be. So your blood vessels start to swell up and dilate. They bring more blood to the area. Therefore, it gets red or pink in color, just like you're seeing right here. And you get cells that move across the blood vessels from the capillary into the interstitial tissues around the skin or subcutaneous tissues in the hair follicle. And those capillaries become leaky, and they allow little cells called neutrophils and macrophages to cross over into the interstitial tissue, where they start to affect inflammatory response. Specifically, the polymorphonucleocytes or leukocytes, PMNs they're called, aka neutrophils, they release enzymes from the cells. So they're like soldiers that release enzymes. They release bullets coming out of them that start to destroy all the tissue around them, everything. Any protein, any fat, any carbohydrate, any DNA, RNA, everything just gets annihilated. So it's like they just get a flamethrower out and just start destroying everything in the area of inflammation. Because what they're trying to do is kill the bacteria, and the bacteria have defenses. Bacteria have a cell wall or a membrane around them that's pretty tough, and they've got glycocalyx, which is a coat around them that's like made out of polysaccharides, and it acts as a shield. So our bodies have developed over millions of years cells in our defense system, our inflammatory system, that are capable of producing very powerful weapons against microorganisms and foreign bodies, right? And that's what's happening right here. As a matter of fact, this herniation is really a foreign body, aka the herniation is a foreign body, because the herniation is made up of two parts. It has the nucleus pulposus, which is the jelly that's staining blue here. The nucleus pulposus is a jelly that is part of you. It's who you are. It's from embryological development. It used to be the notochord, and then after it's done its job embryologically, the notochord then becomes the nucleus pulposus. The nucleus pulposus just sits in the middle of your disc and just acts as a cushion. And your annulus fibrosus, or ligament that holds the bones together above and below the nucleus, that annulus forms a ring around the nucleus pulposus, holding the nucleus pulposus in the center of your disc like a hydraulic jelly, so it can be compressed and it can absorb shock. We call it a shock absorber. Anyway, what happens then, you get a trauma, like an injury to your spine, and the injury tears the annulus or ligament around your disc, called the annulus fibrosus. It's made out of collagen and elastin. So the annulus tears. The nucleus just inside the annulus where it tears fractures into pieces. And then, over time, those pieces escape into the tear and actually get stuck in your annular tear and cause an inflammatory reaction. And that's what causes back pain. That's what causes neck pain. It's the number one cause of back and neck pain in the world is disc herniation. Now, people get confused about disc herniations. I did when I started out, because there's so many different names: disc herniation, disc bulge, disc rupture, disc protrusion, disc extrusion, all these different names for the same thing. I didn't know it was the same thing at the time when I got started, but it turns out it's all the same thing. Let's not make the disc more complicated than it is. The disc is very simple. Annulus fibrosus, nucleus pulposus. Some people include the end plates above and below, but the end plates don't do anything. They're not involved at all. They get degenerated over time, but they're not the cause of symptoms. So here we are with the tear in the annulus. That's what we're looking at right now. That's what's in front of us. And you got pieces of herniation that are stuck in there. That's what I'm releasing with the laser. So it's the stuck in herniation pieces that cause all the inflammation and pain. And that's what we're here to repair. Now, I pioneered the very first treatment in the world for this. And it's called the Deuk laser disc repair in honor of my contribution to figuring it all out. Okay? Prior to me, nobody knew where pain was coming from when it came to the disc. They didn't understand how the disc could be painful. As a matter of fact, nobody believed the disc was the source of pain back in the 90s and early 2000s when I made the discovery in the 90s. Okay? And I started to play with this laser procedure, and I realized I could cure people's back pain by merely doing an endoscopic laser debridement called an annular debridement. And that's when I started to really promote the procedure about 20 years ago. And we've treated now 2,772 patients.
Yes.
You're keeping track, Anthony.
I am, yeah.
Good. All right, any questions? There's a piece of herniation right there. Any questions?
Yes, we have a question from Spicy Irwin on YouTube.
Uh-huh.
Do you take monthly payments?
Do we take monthly payments? That's a great question. I don't know the answer to that. You got to talk to the people that handle money. Kim would be the best person. I don't know if you've done a telemedicine or not, but you first have to do an MRI review and get a recommendation. Otherwise, we can't take any payment because we don't know what you need. We don't just take money and do a treatment. We make sure you need the treatment first and that the treatment is going to work. And then we take your money and do a treatment. By the way, this is fat right here. Now, why is there fat down here? There's always fat. It's normal to have fat in your foramen, right where the cell bodies are for the dorsal root ganglion, because they are highly metabolically active. Okay, highly active. Just about done. This is the hardest disc to fix. It's L5-S1. We're just about done here. There's a piece of herniation. You guys see that? I pulled it out. I saw it there and I pulled it out. That should be the last one. Let me just go take a peek. Maybe able to get one more. Feels pretty good to me though. I think we're pretty much done here. We're done at L5-S1. We're going to move on to the next disc, which is L4-5. Correct, Luis? Sucking all the juice out. There's some fat right there. Any other questions?
No questions.
Roll. By the way, you can see we've lost literally like 1 milliliter of blood, 20 drops. Okay, that's it. This patient's not bleeding. Okay, why? We control the blood pressure. We also have a very small incision. The key is hemostasis. You have to have minimally invasive. You have to have good blood pressure control, good surgical technique. Avoid the big bleeders, the big pipes that bleed heavily in the body. You avoid injuring arteries and veins. You stick to the capillaries. So our patients don't lose blood. They don't need a hospital to do the surgery. We do it outpatient. You go home an hour after the surgery is done. Most of our patients travel from other states or other countries. We have people who have come here from all over the world because they found us and they know we have the best treatment in the world for their problem when they have back pain or neck pain. It's not too hard to convince people. But the problem is a lot of people think, well, I don't know that I want to go to Deuk Spine because it's far or it costs money. And I just do what my doctor here tells me to do. Well, I promise you, what your doctor is telling you to do is not the same. This is less invasive, it's safer, it's more effective, and the results last a lifetime. Their treatments frequently have complications and they're invasive. So just be aware of that. It's worth traveling. I promise you, it's worth traveling. It's worth the money. It's worth the money to have the peace of mind knowing you're going to get the best spine treatment in the world for back pain and neck pain. Hector, we're back to this suction line being right in my way again. You got to have a better solution than what you're doing. All right. Any questions?
Yes, a question from Spicy Irwin on YouTube. How long does pain disappear after the laser procedure?
That's a great question. I love it. Spicy Irwin, I should hire you to ask good question. So Spicy Irwin asked a great question. If I have the laser surgery, Dr. Deuk, when will I notice my pain is gone? The answer is immediately in 90% of our patients, immediately. And what I mean by immediately is by the next morning when you wake up, you're going to be like, well, the surgery pain's gone, and my pain that I had before surgery is gone. 90%. The other 10% of people literally need a few weeks, few days to a few weeks for the pain to go away because they just had such a bad problem. So I would say 90%, the pain is gone the next morning, which is why we have a lot of videos of people coming in saying my pain's gone, right? You guys see that on the testimonial page. But for those people who they can't really tell, it's usually because they have pain from the surgery, which is right where the disc is, and they need a few days for that pain to go away. In other words, the pain from the surgery goes away, pain from before surgery that you guys come to us with is gone immediately after surgery. But a lot of patients still feel surgery pain and they can't tell the difference because the surgery is being done right where the problem is, right where the source of pain is. So they actually feel pain from the surgery, but for most people it's gone by the next day and they come in saying their pain is completely gone. But about 10%, 1 out of 10 patients, it takes a few weeks or a month for that pain to go away. The longest I've ever seen take somebody is 3 months. I had 1 or 2 patients where it took 3 months for the pain to go away. Okay, it's not common, but it does happen. My shoe is so wet. Just soaking wet. All right, let's show the audience how we use the endoscope and laser to perform the Deuk laser disc repair.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. Let's take a look here. We got the laser fiber at 12 o'clock. That's the glass fiber. You've got fat in the epidural space. You've got the outer fibers of the annulus right there. And we have now debrided the entire tear except for this last little bit right here, which I'm working on now. You can see the pieces of herniation right there, the blue. That shouldn't be there. That is nucleus pulposus, should be in the center of the disc, and it should be a white color. That's normal. White and central is normal. It's way out of place. Should not be here. It's completely out of position. Yeah, so what's happening is it's coming down this cable and dripping outside the bag. Any more questions?
No questions.
All right, let's show the audience how our surgery stacks up against the other treatments that other doctors recommend for patients that don't work. Hi, I'm Dr. Deukmedjian. We've just completed our free MRI review with Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that is causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. Welcome back. I won't comment on the video, but look at this herniation. I've been picking at pieces for a while. It is big. It just keeps breaking. We call that friable. Friable. When a tumor or mass in the body just keeps falling apart. It's usually an indication of a lack of good, solid connective tissue. And it's just full of edema from chronic inflammation. You guys see that? It just keeps breaking. I'm literally, it's probably 2 or 3 inches. It's humongous. This is a fresh herniation. We don't see a lot of these, but this is what it looks like. Oh, I think I might have it now. Yeah, that's a good sized piece. So Luis has been collecting pieces. That's a decent sized piece. I hope that's the last of it. It looks like it is. Don't worry about it. All right, here we go. Take that. So we'll show you what we've pulled out. We actually pulled out a lot more than that, but most of it's in the bag. Give me 1 second. We'll finish this up. Look at that inflammation. That is his body trying to heal this tear and herniation, but unsuccessful. Unsuccessful. That's why there's a pink color. That's why there's so much pain. He's going to feel so much better after this surgery. We're removing the herniation, removing the granulation tissue. That's how we fix people's disc herniations, folks. Natural. No metal. I don't think I mentioned to you guys, we just got another patent awarded 2 weeks ago. It's on the website. It's for nanoparticles, copper nanoparticles being used to help repair a disc injury like this. It's my 4th or 5th patent, I can't remember, but we've got more coming. I've got patents in AI, I've got more nanoparticle technology patents coming in silver, and we've got a few more patents coming out. So I've already been told by my attorneys that the government has awarded the patents, but they're called claims. When you get a patent, you have what's called claims, like claiming, if you out there mining for gold and you find some gold, you claim it. It's called claiming it. So there are claims, and each of my patents have many claims that are novel and new and awardable. And so we're trying to just clean up the claims before we take the final award. We want to get as many claims as you can when you're doing patent law that protects that was a pretty good shot, huh? Protects the intellectual property very well. So anyway, this is another piece of herniation we're pulling out. It's not a big one there, but it will add it to the collection. Just like we add to our collection of claims, we'll add to our collection of herniation fragments. All right, any questions? Because we're almost done. I've got about 2 minutes left. I'm going to show you some of these herniations that just came out from this annular tear. This is the key, folks, the future of spine surgery. You're watching it right now today at Deuk Spine. We've been doing the same procedure for 20 years. We've been trying to teach other surgeons to do it. In the United States, I haven't taught overseas surgeons yet, except through these videos. And even though surgeons see what we do and see the great results, they read about it, they still won't do it. Why? Because it doesn't pay as much money as a fusion does. Spinal fusions pay the surgeon a lot more money. And by the way, who decides what surgery the patient is recommended? It's the surgeon. Surgeons decide what surgery is recommended. The insurance companies decide whether or not they're going to pay for it. And ultimately, the patients decide whether or not they're going to do it. But it's not the hospitals, it's not the societies, it's surgeons. And when the surgeons are incentivized to make the most money they can for what they do, they're going to recommend the most rewarding surgery to them as possible. That's fusion. Okay, fusion surgery. That's where I made all my money too, before I did laser. Made a lot of money doing fusions. Just so you know, I make probably about 5 times to 10 times more money doing a fusion than I do a laser surgery. Okay, and that's just me. There are other doctors getting paid even more than that these days. So unfortunately, your surgeon may be recommending surgery to you based on what's best for them, not what's best for you. Be aware of that. Now, I know we're going to have some haters out there who say, oh, Dr. Deuk, you're no different. But I am different. That's why I have patents. Patents don't come to people who don't think out of the box. Patents are awarded for new ideas that nobody else thought of. Go read about it. All right? That's because we're trying to make things better for people, not worse. Thanks for joining us. Any questions? We're going to finish in 1 minute. This is the last piece of herniation.
No questions.
All right. Well, in that case, we're done. I'm going to show you guys right now some of these pieces of herniation that we took out of just this last disc. This last disc had the most. Okay? And it was his highest pain score, you're right. This one was the highest pain score of all 3. This L3-4, which is the one I'm on right now. Okay? Beautiful. That tear that's left will heal beautifully on its own. Doesn't need any metal or fusion. Doesn't need any implants. Okay, look at the herniations we took out of the last one right there. You guys see that? Pretty cool, huh? See all that?
Yes, we do.
We're done. Let's go ahead and leave. Oh, let me show them the incision, how small it is. There's virtually no bleeding. You guys see this?
Yes, we do.
All right, we're done. He's going home in an hour. Joining us, let's leave our audience perhaps with a testimonial. I'm here with one of my post-op patients. We get a lot of requests for Dr. Deuk. Can you show us a patient that had the surgery several weeks ago? Well, here's one. She had the Deuk laser disc repair done at L3-4, L4-5. You were having back and leg symptoms before surgery. How are you doing today?
I have no pain today. I have no pain today. I suffered for such a long time. The leg pain was there for a good close to 3 years. I got to where I could hardly do anything. I'm normally an Energizer bunny. I'm always busy doing something all day long. It terribly curtailed my life. I couldn't hardly do anything without being in pain. And for a long time, I had to push through some just to do normal things, just to get me ready for the day. Now, it's gone.
Amen.
It's gone.
Now, you had your surgery done here at Deuk Spine Institute in Florida in between two massive hurricanes, right?
Yes.
We had Milton recently, and before that we had Helene. And you had your surgeries smack in the middle of those two, between those two hurricanes.
Yes.
What brought you to Deuk Spine Institute?
Well, my husband always trying to find something to help me. He did his research, and online we found you. So we came to see what you offered and what could be done. The other doctors wanted to fuse my back and L5 all the way to my tailbone, and I didn't want that. I was afraid of that. I had done decompression surgery at L3-4-4-5. Within a few weeks after having that done, I was right back in the same pain.
We tell people about laminectomy. You had a laminectomy, it
Yes.
didn't work. I tell people avoid laminectomies. They're removing bones and ligaments out of the spine. It's very invasive, bloody, and damaging. But the laser surgery you had with us, we went in with a small, tiny Band-Aid incision.
Yes.
Outpatient, there was no bleeding.
And no pain from the surgery.
No pain from the surgery.
Wow.
Right?
I couldn't believe it. I'm like, you gave me a prescription for muscle relaxants, and I'm like, no pain surgery? I called to make sure. Are you sure? Because I don't have a drawer full of pain pills because I don't believe in them, but I know I need them for surgery. I needed them when I had my decompression surgery. I needed them when I had emergency cervical surgery, and I had no pain, no surgical pain.
Yes, our procedure is so
Wow.
gentle that there's no surgical pain and you don't need to take painkillers.
No.
Amazing. Well, thank you for sharing your story with us, and you've been through so much, and you're in my prayers. I hope you do very well. Enjoy life.
Thank you. I so appreciate the prayers.
You're welcome.